get injected. So, we had to try and dissolve it. It did take her a couple of times to come in. She came in a couple of times, got injections to dissolve. We probably dissolved 50% of it.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Anabel Martinez, who is a compassionate registered nurse with over 10 years of hands-on experience in aesthetic medicine and 2 years post-graduation. She's an expert in delivering a wide range of non-surgical cosmetic procedures with a focus on safety, precision, and patient satisfaction, demonstrating proficiency in treatments such as Botox, dermal fillers, chemical peels, microneedling, PRP therapy, and laser treatments. So Anabel, welcome and glad to have you here.
Hi, glad to be here.
Yeah, so let's just dive right into it. How did you first get interested in aesthetics?
Well, actually, about 10 years ago, I used to work for a cardiology office as a medical assistant. And I was there for like 5 years, and I was like, I want something different. And I was always very interested about like skin and how to take care of myself, but I didn't really know much. And I got the opportunity to apply at a job at Fun by Michelle. And I went to the interview, everything went well, and I've been there since.
Okay. Now, can you discuss what are some of the common treatments that your clients, your patients come to you for?
So I want to say number one is a lot of Botox. I see a lot of patients for Botox. They're always complaining about, either the crow's feet or like the, lines between the frown lines. Also hair removal. So we do laser hair removal. I have quite a few patients that, want to get summer ready. So a lot of like full leg treatments, arms, even the face. I mean, we get it all.
Got it. Okay. Why do you think some of these treatments are so popular? I think Botox is one. It's been around for such a long time. But I mean, why do you think that people keep continuing to get these treatments?
Well, I mean, from what patients have told me, they like to feel good, right? A lot of the times it's just like maintenance. They come every 3 to 4 months and they just like to how it looks on them. So they're like, no, like I continue doing it because it might not be a big deal to some people, but to me, it just makes me feel like better. And they're like, this is for me. So they keep it up.
Yeah. Okay. Got it. Now, I want to talk about are there any new or emerging treatments out there that you're particularly excited about?
So yeah, actually right now I'm in the middle of training for biostimulation. So it's basically I'm getting trained for that right now through my boss. She is a master injector. So she is training me and that could be injected on the face and it's basically laying collagen. So it's not filler, but per se, but it's they lay collagen and the foundation to start, building your own collagen and elastin.
Okay.
So that's something new. Hormone replacement therapy is also, something that we're starting to do a lot now.
Okay. Now, with the hormone replacement therapy, this is something that is, I guess it would fall under functional medicine. So I'm starting to see more and more aesthetic practices bring this in. So could you tell people a little bit more about what is hormone replacement therapy and like really how can it help people?
So what it is a lot of us as we get older, we lose estrogen. Some of us are very low on testosterone. So we do blood work to see what your levels are. And then with hormone replacement therapy, if you're lacking any of these, if you start feeling like, let's say you have a headache or you're feeling tired or like no energy, you're just like kind of feel worn out, hormone replacement therapy is the way to go because what we do is we inject pellets. So the pellets, it's not something that you feel right away. Like, let's say, like kind of like an IV, you get those medications in and you have those results, like everything right at once. With hormone replacement therapy and with the pellets, it's slowly, going into your body. So it can last you about 3 to 4 months. And our patients start seeing a huge difference in like their energy, like they're more energized. They're, some of them are like, yeah, like I go home and like within like a couple, days, I'm like super, energized. I could clean, I could do this stuff that weren't able to do before, or they would get tired easily.
Got it. So it's a way of fixing you from the inside out in a more natural way of doing it.
Yes.
Okay, got it. And are you starting to see, because I've seen this happen where practices that are getting a little bit more into the wellness side of it, when they start doing these treatments for their patients, some of the patients are able to get off of some of their medications, some of the pills, some of the drugs that they're taking. Are you seeing something along those same lines as well in your case?
Yes, we are. Mhm.
Okay. Yeah, I think that's really just a fantastic thing that's happening in this space, like moving more towards wellness, more towards natural look, more towards natural solutions. Is that something that you're also seeing in the practice?
Yes, we are. Yes,
Okay.
we do that, and then we also have, like with the IVs, like it's the same thing. It's just a little bit quicker. Patients come in, they're like, "Oh, I'm feeling sick," or, "I just got better from like COVID or the flu, and, I need some vitamins." And, we do those IVs, and right away within like the day, they're, energized. And it's rather than, popping all these pills,
Mhm.
all the vitamins in an IV bag, they feel much better.
And why do you think it is? Why do you think that the trend is moving in that direction of more natural treatments, more, I guess, away from pharmaceuticals and more in the direction of kind of fixing it naturally?
I feel like nowadays people are making sure that they don't put just anything in their body. So they're going more the natural way, because a lot of the times some of these medications have other side effects, right? And if we're injecting like vitamins, that's more of like a natural thing. They're more, more for that. And I've noticed that a lot. They're like, "Oh no, like I don't want to inject something that I don't know, or like, possible side effects, aside from like, let's say IV therapy, all those vitamins are all, they know what they're getting."
Okay.
Yeah.
Now, how about on the weight loss side? I mean, how much weight loss does your practice do also?
We do a lot. So
Mhm.
we actually do semaglutide, we do tirzepatide, and we do phentermine. But phentermine's not as popular anymore, but definitely semaglutide and tirzepatide are up there in our office.
Okay. I mean, I've seen some glutide and triglyceride really grow over the last couple of years. I remember a couple of years ago when a doctor was telling me about it, I'm like, I don't even know how to spell that. Like, what'd you just say?
Yeah.
But now it's become so prevalent, and it's now everyone. It seems like everyone is doing it. So, what's your opinion on semaglutide and tirzepatide? I know that it's very popular for a lot of people. There's a lot of practices that offer it and love it, and then there's others that say, well, you have to be careful of this, and this. So what's your personal opinion of semaglutide, tirzepatide, and really which situation would it really work well in, and in what situation would it not work?
Well, I personally think that semaglutide and tirzepatide work really good. We don't just start someone right away, right? We don't just give it to anybody. We make sure that we monitor them. So, for example, in our office, we have them come in weekly, and it's weekly blood pressure checks, weekly weights, and then we get their labs and we make sure that everything's within normal range. If there's ever like, something abnormal, we kind of, that's where the PA comes in, and they're like, "Okay, so, kind of does the physical, gets the history, like, okay, why, what's going on, like, yes, you're a good candidate, or no, you're not a good candidate." So we do have a lot of patients that are on it. We've had really, knock on wood, we haven't had anybody with any like side effects, major side effects where you're like, "Oh no, you can't, you have to stop." There is a drastic weight loss in a lot of our patients, but we do monitor very closely, their blood pressure, their labs, their weight, any side effects. Are you nauseous? Do you feel dizzy? Are you drinking plenty of water? Like, are you still continuing to stay active? Stuff like that.
Got it. Okay. Now, I'll talk a little bit about the practice, Annabelle. Like, when it
Yeah.
comes to practice, what would you say is really the biggest differentiating factor from your practice and others in the industry? I know that when we talked about just the services you offer, there's a little bit more of that wellness component, the hormone replacement therapy, all those kinds of things. But what else would you say really differentiates your practice from others out there?
Well, I've been with this practice for 10 years, basically. I'm going on 10 years.
Mhm.
And, we're like a little family. So, our receptionist, Susie, she is awesome. Like, everybody loves her. She she's like everybody's aunt, right? And a lot of the times people like that. People like to feel welcome. They don't like just, get there, check in and leave. We try to make a connection with each patient. And that's what's really good about us, because we actually, the girls that work there, Michelle, the PA, the owner, Susie, the receptionist, they're really great at what they do. We're really good at communicating with our patients and kind of, really like seeing, okay, what is your concern, like why are you, what is your goal, like, let us help you. And from what I've heard, not that I have gone to any other spas or anything like that, but from what I've heard from patients that have gone to previous locations, sometimes they kind of feel like they just get there, they do their thing and they're out, like, they don't really care to really get to know the patient, be like, okay, what do you really want to achieve? So I feel like that's something that we're really big on that. We definitely like to really get to know our patient, really, know, okay, let's make a plan. What's your end goal?
So a lot more personalized, a lot more connection driven.
Yes. Yeah, because we feel like we really want to know like how we could help you, right? Like we want to make sure that you're comfortable. First of all, you don't want to go to a place where you don't feel comfortable or you don't trust your injector or your, provider. So we try to like get to know like, okay, where can we start? Where can we help you?
Got it. Okay. Now, Anabel, since you've been at this practice for 10 years, I'm sure you've heard a lot of different things from patients, and especially as times change, treatments get better and better. There's a lot of misconceptions, there's a lot of myths out there. So, would you mind sharing just a couple common misconceptions that you hear most often from your patients, your clients, people just coming into the practice?
So, like a very big one that I always hear is with hair removal, for example. Like, oh, well, if I shave, it's going to grow thicker. Like that's something that almost every patient that walks in, especially if it's a treatment for like around your face, and if you're a woman, you don't want to shave your face. You are scared that it's going to grow thicker. But that's something that I always hear. That's not the case. Like we've seen no, that's not the case. It actually, laser hair removal helps. It thins out that follicle. So your hair, it's actually thinner, takes a little longer to grow until it finally, the follicle is killed. Another one is with Botox, for example. Like they're like, oh, well, am I going to be frozen completely? Like, am I not going to have an expression? Well, if that's what you want, but you don't always necessarily have to inject yourself, a ton of Botox. You could have some movement. Some of them think like, oh, well, is it going to like make me worse, so we have to kind of like, no, like that's not the case, like, start off slow, start off little, and then work yourself up if that's the case. Fillers, like lip filler, that's another one. They'll come in and they're like, oh, I want to get lip filler, but my mom says like if I get injected and then I stop, they're gonna get all like saggy, like all. And I'm like, no, that's not the case either. So I mean, there is a couple, that patients come in with some concerns, but I mean, it's not really, something that we're like, no, it's gonna happen. We're like, no, that's not true.
Yeah. Okay. Now, do you ever get people coming in with very heavily filtered social media posts or images or Instagram pictures saying that I want to look exactly like this?
Yes, we have had that. Not recently, because now I feel like it's more, they're trying to go more towards the natural look. But at the beginning, maybe I want to say 4 or 5 years ago, we would have that a lot. They would take out a picture from social media and they're like, I want these lips. And I mean, they had like no lips at all, like very thin lips, and they wanted like really big lips, right? So it's something that would take multiple syringes, not just, one. So we would always be like, let's start off slow and then, we'll go from there, because we're like, we could always, add more.
Yeah. Okay. Now, with that, like I guess there's these two areas that you look at with that. One is that there's that unrealistic expectation of, and it's very because there's filters and all that of I want to look exactly like this. So you have that unrealistic side of it. But then I think it's also hard to deny that social media really fueled a lot of the aesthetic practices growth. Because now it's so much easier to share before and afters. People see that they want it.
Mhm.
So, what is your feeling on social media, particularly in the sense of sharing these images? Do you think it's been a net positive for the industry, or do you think it's been a net negative for the industry?
I think it's been a positive thing because we do get a lot of patients that come in and they're like, okay, I want something similar to this. So we can kind of get to know, okay, like what are you guys looking like? What is out there? What's influencing you guys? Like what is, like the new thing? So I feel like sharing our like before and afters, because we share before and afters in our social media page too. I feel like that's helpful because some of the patients will come in and like, oh, I saw this post, like I want whatever you did to that person. And we are very straightforward with the patient, and we do tell them that not everybody's results the same, right? Like you could see something on social media and that patient could have used 3 4 syringes or could have done laser resurfacing, and then maybe you will need 1 or 2 syringes. I mean, everybody's a little different, so we always try to like make sure to let them know that everybody's results are different. You could always show us, what you see on social media doesn't necessarily mean that it's going to be 100% that, right?
Okay, got it. Now, Annabelle, I'm curious about what is your thoughts when it comes to how important artistry is in your line of work? Because I mean, you're a registered nurse, and I'm sure that when you were learning medicine, there's a protocol, there's a procedure, you follow this step, 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 step. But then being in aesthetics now for 10 years of this practice, uh, you need to have creativity, you need to have that artistry part of it. But I think that's also kind of underappreciated by people until they actually start getting into the industry. So, how important do you think artistry is to be successful in your type of industry?
Oh, I think it's very important because it's all about social media, right? It's all about at marketing. It's all, you have to sell yourself, right? You have to put your work out there so people could see it. And without you guys that, know how to do all of this, it would be very hard for, a practice to do it on their own. I feel like it takes a lot of talent for someone to be able to edit videos, upload images, make website, it's just a whole different thing aside from aesthetics that, we either are too busy to do or too busy, we don't know, so definitely it's very important. I feel like it's all on social media.
Mhm. And how important, if you had to assign a number to it, like how much of it is artistry versus the scientific side of it? Like what percentage you say artistry is compared to the science for being able to do good at aesthetic treatments?
Well, I know, being good at the aesthetic, the science part of it is important, right? Because we want to make sure we know the anatomy of the face, the body, whatever it is that we're treating, right? But I also feel that the marketing department is also very important. I want to say it's probably goes hand in hand because if you can't advertise what you're doing, then no one's going to really know that you're what you're good at, right? So like we could be excellent injectors, we could be excellent at, the weight loss, but if we don't have, that platform to kind of show that off, no one's going to know. So I feel like, both are very important.
Got it. Now, Annabelle, I'm sure that, again, over these 10 years that you've been at the practice, you've probably run into some very challenging cases that have come through the door. Is there one story that you can share in particular that stands out in your mind of someone that came in, really, really tough case, and really how you were able to get them a successful outcome in the end?
So we haven't had that many bad cases, but I will say we did that I remember, and this was a couple years ago. We had a patient come in for lip filler. So she had lip filler out in Mexico. Yeah. And I'm not saying anything, bad about it. There's a lot of great places I've heard, out there. I have some family that live out there that, get treatments out there. But this patient in particular was very swollen, very, very lips very swollen, and she had it for months already. And she came into our practice because every morning when she would drink water, she said it would hurt and they felt like balloon, right? Like a balloon, like ready to pop. So at the time, I was assisting the provider that was, caring for her. And when we asked the patient, like, hey, like, what did they inject? She had no idea. She said that they grabbed whatever it was from a little bottle and she let herself, like get injected. So, we had to try and dissolve it. It did take her a couple of times to come in. She came in a couple of times, got injections to dissolve. We probably dissolved 50% of it, which ended up costing her a little bit more than even getting the lip filler out there. And unfortunately, we saw probably 2 or 3 cases within those couple years with the same thing, that they would go get get lips injected, and they had no idea what they were getting injected. So that was kind of tough to work with, because we're like, okay, well, what is it? Like what's in her lips? What's causing this swelling, this pain, to the point where she's coming in for help. So I want to say that was probably like one of the major ones that we've seen.
Wow. And I think that's an important story that you share, because I've heard this from lots of other practices before. And I think it's something that as a consumer just has to be aware of, is that sometimes they try and go the cheaper route. It's that,
Yeah.
oh, like they just try and price shop. It's like, okay, whoever is the lowest price, then I'm gonna go with them. But they don't think about the quality, not only the quality of the provider who's doing the work, but also the quality of the ingredients. Also, they don't think about that part of it.
Yeah.
And typically, if you go with the cheapest option, you're gonna get the lowest skill level with questionable product that they're using. So, I mean, could you speak a little bit more to that?
Yeah, so I feel like it's very important wherever you go, you ask, okay, what am I getting injected? Like what is it? Like you always kind of want to know, because you never know, like these people are they go out there, they get it cheaper, maybe way cheaper, but who's injecting it? Is it an actual provider? Is it a licensed professional, or is it just someone that got a hold of this medication and is can inject? It could be, like we don't know. So I feel like it's always very important to make sure you go to a accredited place where their license, and know what you're getting injected, because you don't want to end up like them, where they come in, they like, oh, like it's cheap, I'm gonna have lips how I want them, and then you end up paying even more because it's not what you wanted, and now you're like health, like you're swollen, you're suffering.
Yeah, and I think that's the point that you really hit it home, was that they end up spending more money. They spent the money getting it, trying to go cheap, then it's done wrong. They have to spend money to undo it, then they have to spend the money that as if they should have done it right the first time.
Yes.
They're spending probably double than what they should have if they just
Oh,
did it
yeah.
the first time.
Yeah,
Um,
I mean, for example, like let's say you pay like $250 right out there, and to dissolve it, it's like double that, right? Like, so yeah, it's not something that I would advise anybody to do. I'm like, a recommendation: always know what you're getting injected.
yeah, and do your homework. I mean,
Yeah.
I guess you have to be aware of, don't go cheap on it,
Mhm.
because you're probably going to end up spending more. And I don't know about how most people feel, but if someone's gonna be working on my face, I want it to be somebody good.
Exactly, especially if it's your face. I mean, this is what everybody sees, right? And this is what you see every day in the mirror. So, yeah, you have to be careful what you get injected.
Yeah, and within that vein, let's say people are looking around, so they're doing their research, they're looking around. What are some other piece of advice that you would give to them if they're not quite sure which provider to end up going with?
Well, I always say, wherever you feel comfortable, right? Like wherever you get that connection. So, I mean, we get it sometimes, like they're like, oh, well, I've had this person inject me, for years already. I kind of feel bad leaving. Like, no, we respect that. At the end of the day, it's their choice. You have to know where your connection's at. Where do you feel comfortable? Like who do you want touching your face? That's like the most important. So, we don't try to pressure our patients. They come in for their consultations, and then we talk to them. Like I said, we try to get to know them, get to know what they want. And then we allow them to choose, like, do you feel comfortable with me? Are you okay me injecting you? Are and most of the time, yeah, like they go off of like that connection that we share with them.
Got it. Now, Annabelle, where do you think the future of aesthetics is going?
So I feel like they're going more towards the natural way. We're getting a lot of like, oh, I kind of want a more natural look. Their biostimulation, hormone replacement therapy, stuff like that. Yeah, it's going that way. I feel it picking up more. People are going a little bit away from like the fillers and going more towards like what's going to build me collagen and elastin. What's more the natural way to go.
Okay. Now, I know that regenerative medicine is starting to get a little bit more and more into the scene. Not quite sure how much you've looked into it, but I mean, do you think that there's a place for regenerative medicine, and you're kind of in the functional medicine side? Like, do you think that will continue to grow into the future?
I think so. So right now, it's regenerative medicine is very popular, and I think that both combined, it's going to keep growing.
Okay. Now, when it comes to the practice, Annabelle, what's the vision for the practice? Fun, health, and medical aesthetics.
So fun actually stands for feel unbelievably new. So in our office, that's exactly what we want you to feel like when you walk in, and when you leave our office, we want you to feel unbelievably new and, like yourself, like and happy.
Okay. Now, Annabelle, I have one last question for you, but before I ask it, I want to point people to your website at funbymichelle.com.
Yes.
Now, last question is, what does beauty mean to you?
To me, beauty comes from within. That's very important. We have to love ourselves. But it also is, to me, everybody's beautiful in their own way, right? Everybody is beautiful, short hair, long hair, big eyes, little eyes, everybody's beautiful. You just have to feel comfortable with yourself. So to me, beauty is, how you feel. How do you feel inside? Whatever makes you feel beautiful, go for it. Do it.
Well, there you have it. Annabelle sharing her expertise. Now, Annabelle, where can people contact you in the practice?
Well, we do have an Instagram and we have emails that they could also use, and we have our phone number and our social media, our website.
Got it. Well, Annabelle, it's a pleasure. Thanks for being on the show and sharing your message.
Thank you so much.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.